If you've ever opened a chest x-ray and thought, man, I have no idea which rib I'm looking at, this video is for you. In the next few minutes, I'm going to show you how to easily identify and count ribs on a chest x-ray using simple steps that you can apply to any portable anterior, posterior, AP chest x-ray film. We'll separate the posterior from the anterior ribs and improve your chest x-ray interpretation skills in a way that is easy to understand and clinically relevant. All right guys, I'm Dr. Busti and welcome to another topic review at This Is Why, a show that helps healthcare professionals transform their medical knowledge from not just knowing the what, but understanding the why, so that what we do in patient care every day makes sense and doesn't have to be memorized. All right, let's get started. Okay, so our first question is, why should you learn how to identify and count ribs on a chest x-ray? Well, as a healthcare professional, mastering rib identification and counting on a chest x-ray is essential for assessing the image quality. Detecting abnormalities like rib fractures, hyperinflation, the use of ribs as landmarks to localize abnormal findings such as pneumothorax or even tumors. For example, I use the ribs as a built-in ruler, if you will, where we might say, there's an opacity at the level of the 6th right posterior rib, which is obviously more precise than saying something like, there's an opacity at the mid-lung. Furthermore, the skills help ensure accurate diagnoses in certain clinical settings, especially with portable AP chest x-rays, which are commonly being used in hospitals for bedridden patients. Those patients are at higher risk for poor inspiration and rotation, which can mimic and even hide pathology. So rib counting verifies if the image is adequate for interpretation and is commonly used in the mnemonic that I commonly teach about, which is RIPE, R-I-P-E. I'd like to point out on the RIPE mnemonic table that we have available for you at thisiswhy.health for free download if you feel so neat to want to use that or share it with other people, that what we're talking about is determining the adequate amount of inspiration on the image. Well, the way you do that is by identifying and counting the ribs. And you can see that here in letter I for inspiration that you need at least, again, 5 to 6 anterior ribs visible in the lung fields, or at least 8 to 10 posterior ribs visible in the lung fields. And I'm going to show you how to use that. But this all comes together because this mnemonic ties into also the other mnemonic that I commonly teach and use personally in my own clinical practice, which is the A through I mnemonic, right? It's alphabet soup kind of thing. But when you look at RIPE, it's helping us to determine, is this image adequate, appropriate for us to interpret? And part of that process is identifying how many lungs are in the field of the lung fields that you're actually looking at, okay? So in continuation of the image quality, now that we've discussed or reminded you of RIPE and the A through I mnemonic, it's important to know that the portable AP chest radiograph or x-ray, right, where the heart can sometimes be magnified, scapula can often be present in the lung fields, and patients can sometimes, or many times, are semi-erect or even supine, right? These factors make soft tissue interpretation harder. So bones, especially the ribs, become an even more important landmark. So now that we understand why we need to be able to do this, we need to address the next common question. How do I identify these posterior, anterior ribs on a chest x-ray and count them appropriately? Okay, so we're going to move to an actual chest x-ray and some images. And for those of you listening on our podcast channels, I will walk you through this as close as I can. But if you need to think about a chest x-ray in your mind and follow along, that's probably one way to do it. The other is you can go to our YouTube channel right? And you can watch the video and see some of these images that are there while I'm reviewing, okay? Now, let's first identify the posterior ribs. They are the easiest to start with. Okay, so looking at the posterior ribs, if that's where we're going to start, and that's what most people do, you'll see here in a second on the actual x-ray image why people do that. But just to, again, get a visual of the images that we are trying to place in our mind, you can see that we have these anterior ribs up in the front part that are attached to these cartilaginous portions, but they're in the front, okay? And they're curved, almost look like whiskers, which we'll talk about here in a minute. But you see behind there, you got to look through, right? Even on bro, you got to look through the ribs, and you see that the posterior aspect of the rib looks different. They're back here behind there, going in a different kind of direction, okay? Rotating the image around, you can see that these ribs are attached to the vertebrae of the thoracic spine, all right? And so you have to be able to identify not only those vertebral bodies on the x-ray, but then the attachment that gets you oriented so that you know you're picking the posterior versus the anterior. It's very easy to get those two mixed up for sure, okay? Looking at Bro, who likes to participate and is obviously interested in this lecture as well. But again, you can see that there. And then of course we have some additional false ribs down here and down at the base that don't have any attachment. They're kind of free floating, okay? But it's important to recognize these attachments to the thoracic spine. Okay, so now we're looking at the chest x-ray, okay, and a normal chest x-ray. And it's important to see again that the posterior ribs are attached to those vertebral bodies of the spine, and they appear as longer and sometimes even initially more horizontal, right? But then they start to create a steep kind of a arcing curve across the lung fields from the back to the front. So again, looking at the image on the left as a kind of a point of orientation, I'm going to highlight for you the posterior rib. So here's posterior rib number 1, okay? And then here's posterior rib number 2, 3, 4, 5, 6, 7, 8, 9, and then you can see that 10 sort of falls off. So remember that 8 to 10 posterior ribs becomes very important, right? But the first rib is always the one that you really want to try to find first. It's the highest rib. It's also the shortest one, okay? And it sits above the clavicle, right? And so getting oriented to that one can get you started on the correct number, and then you count down from there. Okay, now let's identify the anterior ribs. You know, they attach at that breastbone, okay, in the sternum via cartilage, okay, and they are obliquely coming downward and curving near the midline. Now let's identify the anterior ribs. These attach to the breastbone, again, that sternum via the cartilage, right? They're obliquely downward and curving near the midline. So again, you can start at the top and find that posterior, and you go around, essentially it curves around. And so here is the anterior portion of rib 1, here's the anterior portion of rib 2, here's the anterior portion of rib 3, 4, 5, 6, and 7. And again, remember that 5 to 6 anterior ribs is adequate for showing appropriate inspiration and the visualization of the lung fields and the markings that you should be looking at. And so that's how you can identify those. They look like whiskers crossing kind of the lung fields, and they lose sort of their view as they get closer to the cartilage, right? They become less dense, okay? They're also less prominent on an anterior posterior chest x-ray due to overlapping soft tissue, but also the distance to the detector plate receiving the x-ray beams, right? Now, on a PA, a posterior anterior, where the detector plate is on the anterior portion of our chest, they can actually appear clear. Okay, and that's one way sometimes you can identify an AP versus a PA, especially if you have something to compare it with, because they're closer to the plate. Now, obviously, that is influenced by, again, soft tissue that's present there, okay? Okay, so here's your key takeaways. You know, most start with the posterior ribs first. Find that first posterior rib at the top and then just go down. Most people go on the right side. If you prefer the anterior, recognize that they stop at the midline due to the cartilage, but are obliquely downward and curving, kind of giving that whisker appearance. Remember, you need at least 8 to 10 posterior ribs or 5 to 6 anterior ribs to determine adequate image quality when you're looking at the inspiration part of RIPE, R-I-P-E, remember? And that helps to point us to appropriate imaging for interpretation. Now, you also can follow those ribs back and around and front to back because you're looking for abnormalities and you need to track the lines. Okay, so use them that way. Also consider using the ribs as a ruler, a landmark that you can orient somebody else to if you're trying to point them to a problem. All right, guys, well, I hope you found that to be helpful and something practical that you can use. If you found this information helpful, please, guys, subscribe to our YouTube channel, give us a like, consider sharing, comment, ask some questions, share some of your own experiences. Love to hear from you guys. We all learn from each other. If you want some of the images or you want some of the downloads, those are available for free at thisiswhy.health. Okay, you can go there, download the images, access playlists, collections, get discounts on medical prep products. You can ask questions, join live events when they come out, all those things, okay? Lastly, if you want to see the integration of how to count ribs and why it matters as a part of the inspiration assessment of the image of the quality, consider looking at the lecture that I did on how to read a chest x-ray like a pro. That's where I pull all the parts together and give you a systematic approach to every portable chest x-ray that you do so that you read it like a pro. All right, guys, take care. We'll see you next time.